So today we'll begin a simple primary care review on irritable bowel syndrome. Review. Irritable bowel syndrome, also known as IBS, is a functional disorder of the gastrointestinal tract. Typical clinical presentations are chronic abdominal pain and altered bowel habits. IBS may be associated with other conditions such as fibromyalgia, gastroesophageal reflux disease, major depression, anxiety, and somatization. IBS does not increase their risk of malignancy as it is a chronic disease. Clinical manifestations. Chronic abdominal pain. The pain is frequently related to defecation. Emotional stress and meals may exacerbate the pain, and abdominal bloating and increased gas production in the form of flatulence or belching. Altered bowel habits. Diarrhea is usually loose stool of small to moderate volume. Bowel movements generally occur during waking hours, most often in the morning or after meals. Most bowel movements are associated with lower abdominal cramping pain, urgency, and a sensation of incomplete evacuation. Constipation. Stools are described as pellet shaped. Patients may also experience tenesmus even when the rectum is empty. Diagnostic criteria. Rome 4 criteria. Rome 4 criteria defines IBS as recurrent abdominal pain on average at least once a day per week in the last 3 months, associated with two or more of the following criteria: related to defecation, associated with a change in stool frequency, or associated with a change in stool form, which is appearance. Laboratory testing. Laboratory tests are for the exclusion of other diseases. This includes a complete blood count, fecal calprotectin or fecal lactoferrin, stool testing for giardia, serologic testing for celiac disease. Management. Dietary modification. Dietary modification is the initial treatment. This includes the exclusion of gas-producing foods such as beans, onions, celery, carrots, raisins, or bananas. A diet of FODMAPs, avoidance of alcohol and caffeine, avoidance of lactose and gluten, routine food allergy testing in patients with IBS, and fiber. Psyllium or aspergillus should be considered in patients with constipation IBS. Physical activity may also improve IBS symptoms and the general health. The FODMAP diet. F stands for fermentable, O stands for oligosaccharides, which includes fructans, galacto-oligosaccharides, D stands for disaccharide lactose, M stands for monosaccharides, which includes apples, pears, mangoes, cherries, and watermelon. A stands for and P stands for polyols, which includes apples, pears, apricots, cherries, nectarines, peaches, plums, watermelon, mushrooms, and cauliflower. Thank you.